Hello, my name is Erica.Farrell, and today we will be going over my Pathology of Cervical Cancer project for Structure and Function class. The pathology of cervical cancer, largely avoided through proper screening and treatment of premalignant tumors. More than 50,000 new cases are diagnosed every year. The average onset is between 45 and 55 years of age, but the onset age is steadily expanding. You'll see a lot more 20s and 30s get cervical cancer. Women's health. At age 21, women should start cervical cancer screening. Unless you have been sexually active prior, then you should start cancer screening as soon as you become sexually active. At age 65, you can stop cervical cancer screening, unless you haven't had adequate screening in the past. At age 21, you should start getting pap smears every 3 years, unless you have been prior sexually active. Risk factors of cervical cancer. Risk factors include more common in African American women, Hispanic women, and Native American women, with the risk going up 3% in women with low socioeconomic status, women who become sexually active at a young age, and women who have had multiple sex partners. As you can see, the death rate and incidence rate of Hispanic and African American women is much higher than the other ones. Risk factors continued. Women who are heavy smokers, women who have had sexually transmitted diseases in the past, especially herpes or genital warts. These women are between 2 and 10 times more likely to develop cervical cancer. Women who have had irregular pap smears and irregular gynecological visits, and also immunosuppressed patients. Vaginal bleeding. Most women will experience somewhat unusual and seemingly random vaginal bleeding after intercourse, between their cycles, and after menopause. Vaginal discharge. Most women who are in tune with their bodies notice some changes in odor, color, and appearance of their vaginal secretions, even if they are the only ones paying attention passively. Bloody, watery discharge is also an indication of the disruption of a woman's normal function. Pain during intercourse. Painful intercourse is another indicator that a woman should get checked by a doctor for cervical cancer. The woman may also experience pain in the pelvic region after having intercourse. Back pain. Pain due to cervical cancer can manifest to other regions of the body, most commonly back pain. Bone fractures. Due to a general weakness of the body, bones get brittle, and this is an extreme advanced sign of cervical cancer and should prompt the woman to get medical help right away. The most severe cervical cancer symptoms is feces or urine leaking from the vagina. This is very dangerous, and for reasons of infection, the mere presence of any feces or urine in the vagina means there is a severe problem. This is something that needs to be addressed with the doctor right away. Fatigue, weight loss, and loss of appetite. When the body is trying to fight off the threat of cancer, the cells of the cancer drain resources in the body, making it so the patient lacks their normal function of energy, appetite, and they tend to lose weight rapidly. Swollen legs and leg pain. This may seem like a disconnected symptom, but like the other symptoms, this should be thought of only as a potential manifestation of the cancer cells to the body. HPV, human papillomavirus, has been shown to cause 99% of cervical cancers. Can also cause cancers of the vulva, anus, and penis. HPV turns to cancer whenever the body doesn't clear the infection completely, and the leftover cells change into precancerous cells. spreading to healthy tissue, then breaking off from the tumor and metastasizing. There is an HPV vaccine out now that doctors are urging females over the age of 11 to receive. Stage 1. Stage 1A is smaller than 5 millimeters in depth and is less than 7 millimeters wide, and can only be seen under a microscope. 1B. Cancer measures 4 centimeters or less and can still only be seen under a microscope. It is still confined to the cervix in both A and B. Treatments are possible hysterectomy, but main treatment is a radical trachelectomy with removal of pelvic lymph nodes. Stage 2. Stage 2A, the cancer has not spread into the tissues next to the cervix, but may be in the upper part of the vagina. 2B, the cancer has spread outside of the cervix, including the upper part of the vagina, but is still within the pelvis. Treatment could include hysterectomy, radiation, radical trachelectomy, and brachytherapy, and also chemotherapy. This is a picture of stage 2, with 2A being on the left and 2B being on the right. Stage 3. Stage 3A, cancer has spread to the throat of the vagina, but not to the walls of the pelvis. Stage 3B, the cancer has spread throughout the pelvis, including the lower part of the vagina, sometimes blocking the ureters and causing kidney to malfunction. It may have spread to lymph nodes in pelvis. Treatment could include hysterectomy, radiation, and chemotherapy. And here's stage 3. Stage 4. In stage 4, cancer has spread to the bladder, rectum, or other parts of the body. Stage 4 is divided into stages 4A and 4B, based on where the cancer has spread. Stage 4 is usually not curable. Radiation to help symptoms and chemo is often recommended. Stage 4A. Stage 4A, the cancer has spread to nearby organs such as the bladder or rectum. Stage 4B. Cancer has spread to other parts of the body, such as the liver, lungs, bones, or distant lymph nodes. And as you can see in the picture, it has spread up the body to the lymph nodes all the way up. Effects of cervical cancer greatly depends on the stage and severity. Menopause and infertility, burns from radiation, nausea, exhaustion, pain, edema, and most not common, and most severe is death. Types of cervical cancers. Squamous cell carcinoma, most common of the cervical cancer types. More than 4,200 women die from this type of cervical cancer each year, but the death rate has been declining by about 4% every year. The most important risk factor for cervical squamous cell carcinoma is if this is persistent with HPV. And here's a picture of the squamous cell carcinoma. Types of cervical cancers. Adenocarcinoma is the second most common type of cervical cancers, which makes up about 15 to 20% of all cervical cancers. Cervical adenocarcinoma arises within glands located in the endocervix. And here's a picture of the adenocarcinoma. Preventing cervical cancers. A proven way to prevent cervical cancer is to have testing to find precancers before they turn into invasive cancer. A pap smear in the human papillomavirus Tests are used for this. If a precancer is found, it can be treated, stopping cervical cancer before it really starts. Also, vaccines can protect males and females against some of the most common types of HPV. HPV vaccines are safe and effective. They are given in 3 doses over 6 months. HPV vaccines are most effective when given at 11 or 12 years of age. Also, what a lot of women don't know is men, even though they might not show signs of HPV, they can be carriers of HPV. Here's the survival percentage of cancers, and as you can see, the cervix is pretty much in the middle. Thank you for watching.